I want to welcome all the members of the forum back and welcome all of you who have come to participate. Okay, I want to give you just a little bit of background to the workshop and then walk through the agenda a little bit so that you kind of get primed for how we would appreciate your participation. I'm sure you all know by now that the forum is a group of very diverse members who are together to try to promote children's cognitive, affective, and behavioral health. We want to pay special attention to implementing evidence-based practice and advancing implementation science. But probably many of you know that what public policy tends to pay attention to is problems and crises even more so, and that's just not a good match for children's development. It's much more effective to pay attention to healthy development early on and promote it, and pay attention to preventing problems for kids who are at risk. So that's really what we're all about. Today's workshop, though, has grown out of a special initiative within the forum. About a year ago, several of us formed a learning collaborative to look at how the Affordable Care Act might provide new opportunities to promote children's cognitive, affective, and behavioral health. Over the course of about 10 months, we've had 16 calls with various federal agencies. Some of you are represented today, and we thank you again. And some other related associations or organizations that are in the lead for promoting children's health. I'm not going to go over some of the key points from those calls because I would foreshadow some of what our speakers are going to talk about today. But if there's anything that we've learned in those calls that doesn't get addressed in the workshop, then I'll follow up with that maybe at the end of today. But in many ways, this workshop has grown out of that initiative. We've obviously broadened our scope to not just be limited to the Affordable Care Act or whatever it might be called in the future, or whatever might be left of it, but healthcare reform more broadly and various funding streams. So our workshop today is devoted to paying attention to how we can promote children's behavioral health, how we can make use of innovations, and how we can sustain funding over time. A few key points. You may notice we designed the workshop specifically to have a lot of discussion. So again, I thank most of you who are here to participate in that. We want to try to resist thinking in silos, even though I know those are going to be apparent. We want to kind of pay attention to where they intersect. The workshop is inclusive of all children. We're taking a population health approach here. So even though we will talk quite a bit about prevention and health promotion, we also want to be attending and thinking about children with special health conditions or behavioral health conditions. We encourage a two-generation approach. That is, considering how to fund programs and services that support not only children, but parents and families. You'll find that that's a key point that runs throughout the workshop and the forum. As probably many of you know, quite a few of the evidence-based prevention and intervention programs involve parents. So we have a real obligation to figure out how to fund those, both on the insurance side and on the prevention side. Okay, here's a couple of key questions that we're looking to answer. Where is it possible for us to drive progress? Where are the gaps in funding? Where do we need more research? What can this forum do? Where and how can we collaborate with you and other stakeholders to have collective impact? So try to organize yourself and your thinking around some of those key questions. Okay, I want to just mention a little bit about our agenda. We've invited a series of panels of experts, as you can see from your agenda. Some of them will be representing funders. Some of them will be representing what we call intermediary organizations. And some of them are what we're calling boots on the ground, who are people actually doing best practices and doing innovations and can help us understand how can they sustain what they're doing and where are the obstacles for them? Where do they get their insecurity from in terms of funding? We're looking for actionable suggestions, so don't be shy. We designed this workshop to touch on the very thing that you just mentioned, Lark, which is that the Affordable Care Act is raising issues like accountability and health promotion and prevention. And we are seeing incredible opportunity within primary care to really make change. And that's part of why we do feature it a little bit here. But we know that there's going to need to be integration across other systems. And we're hearing that, we've heard that a little bit more as the day went on. We know that the Affordable Care Act also affords us the opportunity to pay attention to parents and to parenting. But we still have a long way to go because many kids are insured with Medicaid now and parents are not. Right? I mean, that is just a huge problem. So, we still have a lot of work to do on the public policy side. The school-based health centers were not funded in the ACA. A capital expansion was, so there was new facilities stood up, but a lot of what John described about the National School-Based Health Alliance, the operations of those school-based health centers has not been funded by the ACA. That's another huge gap. We've heard again today, but we learned in our research over the last year that a lot of really good innovations in research and services that have been driven by the ACA are still adult-centric. That's still another problem that we have to take on. And one of the things that I found most helpful, and I forget who said this, but what you may be sitting here, so I apologize, is that it's going to be important for us to engage the adult health community to teach them about the life course health perspective. Like another silo we're not paying attention to is pediatric and adult health systems. And so we need them to be partners with us, not, the other side who's getting all the money and all of the programming. There's a lot of exciting opportunities for alignment and collaboration, especially with education and health. I find it so ironic that we used to have a federal agency of health, education, and welfare. Isn't that ridiculous, right? And here we are back again saying, wow, why do we have these silos of health and education and welfare? So, I could go on, but it is important for us now to start to think about, especially for a research agenda, that we start to track in both investments and outcomes across social services and across education and across health. And that was raised in some of our information gathering calls, that social services, for example, may have outcomes on health, but they're not being measured, and vice versa. There's one thing I want to mention as a caution, and we've had this in other workshops, that terminology differences still pose a barrier. So, there's different definitions for integration. There's different definitions for behavioral health, and there's different definitions for evidence. Those are just a few, but those are still really important barriers that we need to take on. There is a lot of movement in measurement and in screening, but we still have a long way to go because a lot of good screening measures, including some that federal agencies are trying to stand up, are not yet well translated for certain populations or validated for certain populations, especially some of the most vulnerable ones. So that's still a problem. And then a last point from this information gathering work is that the policy emphasis in the ACA, and maybe rightly so as a starting point, has been access to care, but it doesn't mean there's providers to deliver that care. And then there's a further gap for delivering evidence-based practice, right? So access might be improved, but it's only the beginning, and so we still have a huge amount of work to do there. Okay, so it sounds to me, though, from listening today, that we're kind of at something of a tipping point. There was a lot of consistency across several people in terms of what they're recommending, and that's an exciting point. We also heard that it was a gargantuan task. But I think we're up to the job, and we're going to actually try to move the needle a little bit more tomorrow.